Hello, my name is Pauline RN. Welcome to my channel. Today we'll be talking about nutrition, questions and answers directly from RN Nclex examination. Please hit the thumbs up. Please subscribe to this channel. Please share this video. Thank you. My first question is, in nutrition, always assess what? The correct answer is the ability to swallow and chew. Assess the need for patients to have dentures is the correct answer. Next question. What will be the diet of a post-op patient? Correct answer. Diet of a post-op patient will be NPO, advanced to clear liquid diet, is the correct answers. Please note that bariatric patients are not allowed straws post-operatively. Next question. What is a clear liquid diet? Correct answer, ginger ale, water, gelatin, bouillon, ice pops, icicles. These are all clear liquid diet. Post-operative patients, when we say a clear liquid diet, we would not give post-operative patients cranberry, anything that's red, as a clear liquid diet. Clear liquid means anything that's liquid at room temperature. You have to be able to see through the liquid. If it's cranberry, that's red. Post-operative patients, especially GI patients, they are at risk for hemorrhage post-operatively, so we have to be able to identify if they are bleeding or not. So when the doctor order a clear liquid diet, do not give them cranberry juice. Next question. Doctor has ordered NPO before surgery. What does that mean? The correct answer, the doctor has ordered NPO the night before surgery means nothing to eat or drink. No water, no food the night before surgery. No water, no food before surgery. NPO, nothing by mouth. It's okay for mouth oral care. It's okay for patients to brush their teeth, but they do not swallow the water. Nothing by mouth before surgery. Before surgery. Sometimes after patients come from surgery, they will remain NPO. Nothing by mouth. The doctor will give us an order to let us know when it's okay for us to advance their diets to a clear liquid or regular diet. Next question is, how do we assess cultural choices and spiritual choices of our patients? The correct answer, we should know Jews, people who are of the Jewish religion, their diet is a kosher diet. Seventh-day Adventists, they do not do seafood or shellfish. Asians, they do not do any ice water, no cold liquid. They will do tap water only. For some patients, if they are given the incorrect dinner tray, breakfast tray, always return everything on the tray. Next question. African Americans, what are they? African Americans, what diet can they not tolerate? African Americans must be on a lactose intolerance diet. Some of them, lactose intolerance for African Americans. What does celiac diet means? The correct answer, celiac diet means gluten-free diet. Avoid wheat, rye, yeast. Next question, what is a DASH diet? This is a correct answer. A DASH diet is used to control high blood pressure, hypertension. Patients with hypertension, the DASH diet includes whole grains, low fat, nuts, beans, low sodium diet. Teach patients to avoid canned foods. Let them check the labels on their cans. Check labels. The DASH diet is to prevent and control hypertension. Next question. What would be our diets for elderly patients with poor nutrition, pressure injury, malnutrition? What would be our diets for those patients? Poor nutrition, pressure injuries present, malnutrition. The correct answer, these patients would be on a high-calorie diet, vitamin B and C, proteins for wound healing. These patients who are malnutrition, sometimes they are on a parenteral nutrition, IV, enteral feeding. These patients are on tube feeding because some of them are not able to swallow. They are NPO, or patients who are tube feeding, NPO, 90 degrees. When do you do your nutritional assessments is the next question. The correct answers, will do our nutritional assessments at time of admission to make sure our patients are receiving the correct diets while they are in the hospital. Patients with diabetes, diabetic diet, patients on dialysis, renal diets, patients with heart problems, cardiac diet. How do we prevent dehydration in our clients? How much liquid do we give them on a daily basis? The correct answer, we give them at least 2,000 cc of fluid a day to prevent dehydration. Remember, if patients are NPO, nothing by mouth to eat and drink, make sure they're getting IV fluids to assist them with their hydration. Make sure patients who are restrained, you're giving them their fluids to drink because they're not able to feed themselves because they have restraints. Next question, what are our macronutrients? The correct answer, these are our carbohydrates, fats, and proteins. What are our fat-soluble vitamins? Do you know? Correct answer, vitamins A, D, E, K, a deck. A, D, E, K. What are our water-soluble vitamins? These are our B's and C's. What do we teach pregnant patients about their diet. We will teach pregnant patients to include folic acids in their diet to prevent neutral tube defects in infants. That is the correct answer. Where do we find folates and folic acids? These sources are in green, leafy, dark vegetables. Please hit the thumbs up. Please subscribe. Please share this video. Stay tuned to part 2, Diets and Nutrition. Thank you. Have a good day.